Eloquently speaking. Welcome back to another episode of Legal Talk, where law meets justice and advocacy becomes action. I'm your host, Dr. Vickie Simon, and in today's episode, we discuss the shutdown, sick care, and survival. We will also discuss the fight for healthcare equity in Georgia and what happens when the government's dysfunction meets community desperation. Because when Washington goes dark, our most vulnerable neighbors lose their light first. Come on, let's get into it. Before we talk about the shutdown and funding freezes, we need to start with the truth. Georgia's healthcare system was already unbalanced. Rural hospitals are closing. Black and brown communities are uninsured at higher risk. And in far too many counties, people are dying from preventable conditions simply because there is no doctors within 50 miles. That's not just a health issue. That's a justice issue. And healthcare equity means everyone, regardless of their zip code, race, or income, deserves access to affordable quality care. But Georgia's policy haven't always supported that ideal. When budgets tighten, underserved communities are the first to lose. Now, with the federal government shutdown looming, that fragile system is about to be tested again. So what happens when the federal government shuts down? Funding for SNAP and WIC, lifelines for nearly 1 million Georgia residents, may be delayed or reduced. Public health grants that fund community clinics could freeze mid-cycle. And research and hospital support programs like Hospitals at Home and maternal health pilots could stall. And when those funds stop flowing, it's not Washington that feels it first. It's families in Atlanta, Macon, Albany, and Bainbridge. Think about the mother that's waiting on her WIC benefits to buy formula, the veteran that's relying on SNAP to get through the month, and the senior who can't afford their insulin when Medicare assistance halts. That's not politics. That's people. And a shutdown doesn't just delay paperwork. It delays meals, it delays medicine, and it delays hope. Now, let's be real. Our healthcare policy was never designed to keep underserved communities healthy. It was built to treat symptoms, not causes. It funds crisis, not prevention. And it rewards systems that already have resources. When policy does not prioritize equity, it's not just oversight. It's oppression with paperwork, of course, attached. In Georgia, over 250,000 residents could lose coverage if federal subsidies expire during this crisis. Rural hospitals are already on the brink, and with every week of uncertainty, more doors could close permanently. Healthcare is a right, not a reward for stability, and yet the people who need care the most often have the least access to it. Now let's talk about food, because hunger and health are inseparable. If the shutdown continues through November, Georgia is facing a real food access emergency. Food banks are already warning of shortages. Demand is rising while donations fall. But there are resources available, and I want every listener to hear this part clearly. If you or someone you know is struggling with food insecurity, please write this down. Atlanta's Community Food Bank, they partner with over 700 local organizations to distribute food across 29 counties. Middle Georgia Community Food Bank, they also have SNAP coordinators who can help you apply for benefits. And resource centers for community actions, they are located in Conyers. They provide food assistance Mondays, Wednesdays, and Fridays. If you're in another county, please visit feedinggeorgia.org for a full list of food banks statewide. No one should be ashamed to ask for help, especially when the system built to protect them has failed. So where do we go from here? We start first by telling the truth. The government shutdown is not just about politics. It's about people losing their lifelines, people losing access. We need to demand transparency. We need to demand emergency funding for public health and nutrition programs. We need to demand long-term healthcare policy reform that centers equity and not profit. And we need to organize, because when our leaders fail to plan, the people must prepare. Georgia, we are resilient, but resilience should not be policy. We should not have to fight this hard to survive. If you're listening right now and you're hurting, know this: you are not forgotten. Community organizations, faith networks, and neighbors are stepping up where the system steps back. If you can donate, please do so. If you can volunteer, please do so. If you can amplify this message, please do so. Because justice doesn't just begin in Washington. It begins with us. And when we align together, policies shift, doors open, and hope multiplies. Today, we talked about healthcare inequity, the shutdown, the real life stakes that are facing Georgia families. But here's the truth I want you to carry: that faith without policy is frustration, and policy without equity is injustice. So until next time, stay informed, stay ethical, and keep serving your community. Legal Talk isn't just commentary, it's resistance. It's a call to action and a reminder that justice doesn't come from silence. Let's make sure that this is one of many episodes that does not just change minds, but changes policy. And I'll see you on the front line of reform. Because when systems break down, we build up together. Thank you for tuning in to another episode of Legal Talk. Again, I'm your host, Dr. Vickie Simon. Until next time, bye.